Hi, I'm Dr. Pilling, and I want to talk to you a little bit today about a condition we call peripheral neuropathy. This is a term a lot of us hear, but sometimes there's a lot of confusion as to what it is. Basically, peripheral neuropathy is a condition where our nerves out in the arms and in the legs, and especially down into the feet, aren't working properly. And that produces a problem. We feel sensation and feeling that's not normal. It could be burning, it could be tingling. Sometimes when you're trying to rest and get sleep at night, you just can't, because it's like those nerves wake up. You're always looking for a way to relieve pain. You're looking for some topical pain reliever. You're taking something orally, a pill to try to decrease that, but it just doesn't want to go away. As you get moving, a lot of times it feels a little bit better, but it's just always there in the background. So when you hear the term peripheral neuropathy, think of this as a condition where the electrical signal traveling through the nerve is running into some problems. It's shorting out or not communicating from one end to the other the way that it should. So the nerves are firing in a irregular pattern, and that's being interpreted as pain. So neuropathy is a condition that's fairly common. We find it associated with a lot of health conditions. Diabetes is maybe the most prevalent, but certainly not the only condition that can lead to peripheral neuropathy. Sometimes we find it in families. Oftentimes it progressively gets worse. That's the unfortunate part about it, is it doesn't just stay the same, it gets worse. Certainly some pain is caused by spinal problems. If there's a compressed nerve in the lower back, that can create symptoms that show up in your feet. We call that referred pain. In conditions like this, it's important that we localize and identify the source of that pain so you can get appropriate treatment. But how do we actually treat most types of neuropathy? Therapy usually starts with a nerve test, something to verify or confirm what's going on. And once that's confirmed, we begin treating with some agent that's designed to help decrease what you're feeling. We're treating the symptom. So there are many medications we use for this. Unfortunately, none of them do a great job at alleviating all of the pain. And so peripheral neuropathy gradually progresses, and it starts out from something that you feel to something that affects your strength. Those nerves that are traveling to the distal parts of your body not only give you a sensation, but they innervate or attach to muscles, and they control movement. And as you start getting damage or wear and tear to those nerves and they begin to not function properly, it starts to affect our ability to move and get around. We start becoming a little bit stiffer. We aren't quite as nimble on our feet. As we walk, our gait kind of widens a little bit. We maybe start shuffling. We're not so sure on our feet of our balance, and our stamina decreases. We start being careful and sitting on the edge of the chair so we can get up a little bit more, and we tire a lot easier. We really start to lose our confidence, and as progressive neuropathy gets worse, it starts to affect our ability to function and to do our normal activities of daily living, and we start to lose our independence. So peripheral neuropathy is a real problem, and most of our therapies up until now are centered around how to alleviate pain. It's known that we do not have a cure for peripheral neuropathy. So I imagine in talking to your doctor, you probably heard something to the effect of, Mr. or Mrs. So-and-so, I'm sorry to tell you you have peripheral neuropathy. We're going to help you, but it will gradually get worse, and it will affect you more and more. But we'll try to make that less painful. We'll try to help you to sleep a little better, and we'll make some changes in your lifestyle to hopefully slow down the progression of this condition. But we don't have a way to stop that, and definitely not to reverse what's going on. If you heard something like this, that's because that's how most doctors have been taught, is that there's not much we can do, that peripheral neuropathy is something that's going to progress and eventually is going to become quite debilitating. And so that's a little bit about peripheral neuropathy. The good news is there are some therapies and treatments that have gone against this trend of progressive damage, that have shown some improvement, not just in symptom, but in terms of function. So what I want to do is to talk to you a little bit about some of what those things are.